So let's get into treatments.
Yeah.
So we've already touched on a little bit of like lifestyle change, right? You could add to it, and also what kind of pharmacological regimen as well that you do prescribe for your
Yeah.
patients.
So the key thing is that we have different types of medication for diabetes. I'm not going to go into depth of it because it's for the layman.
Right.
We start with, so here, because of coverage, insurance, in Canada, we use, it's all about insurance. The insurance companies want you to start with metformin.
Okay.
Want you to be on before you can go on to some other ones.
Right.
Now, if you've had a heart attack or a stroke, then you could probably go on to another thing we're going to call Jardiance.
These are oral.
Yes. We're talking about orals now. You understand me? Yeah.
Medication that you take by mouth.
Yes, medication taken by mouth. Yes. So because of insurance purposes, we normally start people on metformin, which is effective. It's effective. It's cheap. It does the trick. I have some patients. All they're on is just metformin.
Okay.
All they're on is just metformin. And it's been working for them, but everybody's different. So because this person, I have some people who are on insulin. I have some people that are on metformin and 2 other medications. So nobody is the same.
Right.
So if you say, oh, but my friend is on metformin, how come I'm not on metformin by myself? Well, because your body is different from your friend's body.
Yeah. So that's the key, right? The way glucose and insulin work, it will be different for every individual. Your lifestyle and all of that. Yeah.
Yes. We've talked about so metformin is what I tend to use, and I start small. The key thing about metformin is to start with a small dose.
Okay.
So first of all, when somebody's newly diagnosed with diabetes, it depends on what the blood sugar is.
Yeah.
And then it depends on what your blood sugar is over the last 3 months. If your blood sugar over the last 3 months has been over 8.5, I'm going to start you on medication straight away. That's the guidelines, because there's no natural event you're going to do that's going to make you bring down your sugar levels. You understand me? Even if you watch what you eat, lose some weight, exercise, it's not going to bring. So above 8.5, I'm going to start you straight away on medication. But the key for metformin is to start slow. That's the key thing. I normally start with 250 or 500.
Okay.
And then after a week or 2, I bring them back and I gradually increase it. And then while I'm doing that, we're monitoring the sugar levels as well. You understand me? I have some patients who are only on 1 tablet of metformin. And I have some patients who are on more than 1 tablet of metformin. So it depends, you understand me? Now, metformin does have side effects. It can upset your tummy and it can cause some diarrhea. And there are some of my patients who don't tolerate metformin. So you got to be aware of that. But the key thing when you start metformin, you have to start slow because of the side effects it can cause. And some people, metformin might be the only thing that can do the trick for them. And some people, metformin may not be the only thing. Now we're talking about this management is about type 2. Type 2,
okay.
Because for type 1, it's insulin. There's nothing like metformin for type 1.
Right.
Okay. So we start with metformin. Now, you don't go beyond 2,000 grams of metformin because research has shown that above 2,000 it may not work.
That's per day?
Yeah, per day.
Okay.
Don't go. There's no point. Once it gets to 2,000, you start looking for another medication to add. Because research has shown that, above 2,000 it may not. But sometimes some physicians might go up to 2,500 occasionally, not all the time. But most times, once it's 2,000, that's it. They go over to the next medication.
Okay.
Now, the question is, what's the next medication? Well, it depends on what is happening in your life, you understand me? So it could depend on if you're very overweight. It could depend on your cardiovascular risk factors. The question is, would you go for insulin straight away after metformin? Now, I had a patient one time who was on insulin and metformin.
Okay.
Now, fortunately, if you've never been on medication before, we have other medications that we can use before you go straight to insulin. That was back in the old days. Back in the old days when we didn't have these intermediaries before insulin, people went to metformin. And I saw this lady, she came to me, joined my practice. She's on metformin insulin. I looked at it and I asked her a few questions and I thought, maybe we could reduce insulin. Maybe we might be able to help her get off this insulin. You understand me? And then maybe she's looking at me, who does this guy think he is? You understand me? Getting me off insulin.
And just to highlight it for type 2, it is possible to get you off of insulin. Depending
on this.
Right, there's all factors.
And it depends on why you were put on insulin. Now, if you've been losing a lot of weight, if you lost a lot of weight, they've tried everything, you need insulin.
Okay.
You understand? There's some people, they're rapidly losing weight, blood sugar is not controlled up the roof, you need insulin. You understand me? But there are some people who, after metformin, they were put straight on insulin. Just because of the high blood sugar, there wasn't really any metabolic event going on.
Okay.
So in those kind of situations, there's some other intermediaries now that we can use before insulin. So when this patient came to me, he was on metformin and insulin, I said, maybe we could, use some of this stuff. So she was overweight as well. Okay. So I used Ozempic on her. And guess what? I got her off insulin.
Oh, look at that. Amazing.
And then even when she left my practice to a town that was more than a 3-hour drive, she would still come to me as a doctor.
Well, hey, I'm stuck with you.
And she now says she can now trust me.
Oh wow, look at that. You need to see results.
Thank you for trusting me.
There you go with faith.
because I looked at it, because the other drugs we have now, which are good products, you understand, which we can use. So the key thing is that would I jump straight to insulin after this thing? Well, if you're not having a major metabolic instance where you're losing rapid weight, your blood sugar is like up the roof. Right. No, I wouldn't. There's other things we can use.
Okay.
Now we have something called, I tend to use Jardiance.
Okay.
Jardiance, which is a good one. It's an SGLT2. I like it because number one, it protects your heart. So the people that are on Jardiance, research has shown that it prevents you from going to the hospital for having a heart attack. So it prevents you from having a heart attack, and also it protects your kidneys as well. So I like it as well. You understand me? So depending, some patients, the next one I could go on is to Jardiance. Okay. And if you're very overweight as well and got some cardiovascular risk, I might go to Ozempic straight away as well. The problem is coverage. Like in the past, they used to cover Ozempic here, but now some companies don't, because everybody was using Ozempic, so it became too expensive for the pharmaceutical companies. But Jardiance is a good one. I like Jardiance. So so my second line could be Jardiance, it could be Ozempic, the ones I like. Okay. Now people are asking, what about sulfurias? Sulfurias like like glycoside and all those kind of things. Well, in the past, you used to use it, but the problem now, we realize that after a while, the effect wears off. Oh, okay. So that's why we don't tend to use sulfurias right now. You understand me? And even when you go for conferences, because I go for a lot of diabetic conferences as well. And those are where you meet the guys that even write the guidelines for diabetes. You understand me? That's nice. And I also moderate some diabetic events as well,
So you're in contact with the latest research?
I hope so. It's always good to be up to date with the latest.
We're so grateful to have such a wonderful personality here.
We thank God. So when we do this is normally for doctors. So when we're doing like case reports, normally what we do is, we're going through cases, they go through cases and say, okay, this person's on glycoside, this person's on metformin, right? And the blood sugar is still not controlled. Is there anything you would do? And we say, hey, probably take the glycoside and put in maybe EMPA. Oh yeah, that's the right thing to do. Okay. Because we know that the sulfurias, yes, they work, but the problem is that the effect doesn't last as long as the other one. So most doctors now, after metformin, don't jump to glycoside, the sulfurias. They'll go to like a SGLT2, like Jardiance, or they'll go to something like Ozempic. You understand me? Okay. So that's what I tend to do. So I'll either go to I'll either use EMPA as my second line or Ozempic, depending on, Okay. Sometimes if your kidney function is not as good as I want it to be, I might go to Trajenta as well. That's another drug we can use. So it all depends. You understand me? Now, you have the key thing now about it is monitor. Yeah. So every 3 months, it's good to get your HbA1c done. So I have my patients, they do the HbA1c every 3 months. Okay. The good beauty about that, I know how they're doing every 3 months. Right. Because there are some people, if your blood sugar is consistently above 8.5, that's the average over 3 months, unfortunately, you might have to go on insulin. But like I said, that's after we've tried like Jardiance, Ozempic, all the options. But if, for example, now we haven't tried some of it, we'll try it, because I have some patients now who are just on Jardiance and metformin, and the blood sugars were controlled.
Oh,
I have some patients who are on 3 of them. They're on Jardiance, they're on metformin, and they're on Ozempic. Or you understand me? And the blood sugar, or Mounjaro, and the blood sugar is controlled with that. And there are some of my patients. I mean, I had a patient one time, and I told him, he said, "Doctor, I want to go on insulin." I was okay. So, and then the next time he was high, and I said, "You know what? I've been tolerant with you. You know that. In terms of, you say you don't want to go on insulin, but look at your results now. They're both consistently above, I think above 8 point something." I said, "You got to go on insulin, my friend."
Oh.
And then the guy says, "Okay, doctor," and he went on insulin.
Okay.
Because there's nothing I could do about it. He's on all the good medications, all the intermediate medications, and your blood sugar is still not being controlled. Come on, we need to control this thing. And then you need to be on insulin. And then I started him on insulin.
Okay.
And he's doing much better now.
That's good.
You understand me? And some of them will tell you, my sister, my brother had insulin as well,
Yeah.
But because your brother or sister is on insulin doesn't mean you will be on insulin. Let's get that right. It doesn't.
There's already that fear of being poked so often, right? Yeah.
But we have other things now, which we shall go into.
Okay. All right.
I got you guys.